Thank you for joining us and welcome to another edition of Critical Issues, Alternative Views. I'm Ron Kramer. I'm a professor of sociology at Western Michigan University, and I'll be the host for the program today. With me are two of our regular Viewmeisters, and we have a very special guest today. Let me introduce our regulars first. To my right over here is Felix Brooks. Felix is the Officer of Diversity and Inclusion at Kalamazoo Valley Community College. Moonlights teaching criminal justice sometimes at Western. Whenever I can hire him, I have done that. To my left is Don Cooney, and Don is a professor in the School of Social Work at Western Michigan University. And Don is also the Vice Mayor of the City of Kalamazoo. And joining us for today's program is Angela Gross, right? And Angela is currently working as a Spanish interpreter for KRISA.
That's right.
She formerly worked at Kalamazoo College. And she is here today to talk about the Affordable Care Act because her family situation is personally affected by the threat of the repeal of the ACA. So that's the main focus of our discussion today is the Affordable Care Act, also known as Obamacare. I hate to use that term, but a lot of people, and it's funny how some people don't know that the Affordable Care Act is different from Obama, or they think it's different. They don't know it's the same exact thing. So anyway, but before we get to the Affordable Care Act, I thought we needed to spend just a little bit of time getting some reaction to the very first week of the Trump administration. And it's been a crazy week in all kinds of ways. So from the inaugural address and then just all the executive orders that Trump has been signing during the week and the very fierce pushback, resistance, and protest that has been generated just in his first week of office. So Felix, let me start with you. What's your reaction to the first week of the Trump administration?
Well, it's sort of a metaphor for, unfortunately, the tornadoes that came through the South, indiscriminate and pretty destructive in terms of the amount of executive orders that he signed. With, in my mind, very little thought to the consequences or impact of what those orders are going to have. It just seems to be a tearing apart of what the previous administration had put together. Just because these were campaign promises that he made, now it feels like you got to follow through with them to the folks without any inclination at all what the impact's going to be long-term wise. So, and I think that's a dangerous trend.
Oh, yeah.
I mean, we heard about his issues with Mexico. We'll talk about a little bit about the Affordable Care Act, some things that are going on with respect to that. The immigration issues with respect to now he's talking about us going back to extreme vetting of folks who get into this country, closing the borders down. All that stuff is really troublesome, and in my mind is anti what America stands for.
Don, how about you? What's been your reaction to the first week?
Terror. And a great fear because some of the decisions that he's making are going to hurt people that are most vulnerable in our society and internationally enormously. And I really am upset, as Felix indicated, with his inability to think through what he does. He acts so much on the spur of the moment without trying to get any in-depth analysis of the consequences of his acts. And the decisions that he's making are major decisions that are going to affect millions of people. And it's really very frightening to have a person with so much power and so little competence to deal with the issues he has to make.
Poor impulse control, that's a big one.
Exactly, right. And it's all about Donald Trump. It's not about the country or what we stand for. He takes everything so personally, and it's all about his personal standing. I mean, just his what do you call it? His relationship with the media, calling them the enemy. Yeah. Well, he didn't do that, but his man did that.
Steve Bannon.
Steve Bannon did that. Yeah. So I mean, I think we're in for a very rough time. On the other hand, the heartening thing is the response. The activism has been so strong around the country, locally. It's really encouraging. And I think it's really forced us to think through issues in a way that we weren't thinking through them before.
Right. And I think if we go back to the inaugural address, when I listened to it, the first few lines had, you know, a little bit of maybe gracious attitude in them.
Yeah.
But it quickly devolved, in my opinion, to something that was, again, full of anger, not healing. And I guess I had hoped that the speech he gave on that day at that event would be a little bit more unifying. But it was the same Donald Trump that we saw throughout the entire campaign. So
Yeah.
just the kickoff to this presidency has left me really disheartened and troubled.
It seemed less like an inaugural address that's meant to uplift and inspire the American people than it was another stump speech during the campaign and
Exactly.
painting the darkest possible portrait of the country and why only Donald Trump could save us from the carnage. I do use that term,
Yeah,
carnage.
the term a
The
lot.
carnage stops
Yeah.
now, and I mean, just that kind of language, certainly not in the history of the tradition of the inaugural addresses,
Right.
which are meant to inspire.
And making that clear enunciation between his so-called friends and who his enemies are.
Oh,
You know,
Exactly.
wow.
which is, you know, that's classic dictatorial speak. you
Yeah.
know. Nothing coded about that at all.
No, I'm
and
very
with the press
divisive.
being one of his, you know, his main enemies, as Steve Bannon said yesterday. So
Mm-hmm.
they're loyal. They're the opposition. You're the opposition party.
And how the Republicans are falling in behind him. They're just, the things that they stood against before, now because he's advocating them, they're right there for
That's
him.
right.
And he's leaning towards following through on some of the things that they're proposing. The way he talked to Ryan yesterday, saying, you're working really hard, I'm going to sign those things. Well, if Ryan, his budget is so destructive of the most vulnerable people in our society, cutting back on social support programs enormously, looking at Medicaid, Medicare, even Social Security to privatize it. And now Trump is leaning toward following him. It's just very troubling that these guys with so much power that there's very little dissent coming from that side.
Yeah.
From the other side, there's great amount, but the other people have fallen in the line.
Right. I'd like to just mention, too, the alternative facts
Oh,
episode.
yeah.
When the
Great
very
point.
first move that the press secretary makes as he steps out into that brand new role is to state things that aren't true and then be defended as he was defended by Kellyanne Conway on some of the morning news shows after that. It was appalling and comes across as fiction.
Well, finally, the New York Times just came right out and said when Trump claimed that, all these millions of people voted illegally, the reason that he lost the popular vote was all these illegal votes.
Yeah.
And the New York Times basically said this was a lie.
Yes,
And that's
strong.
That's very strong language, and it's interesting because the media has been reluctant to come right out and say that. You know, they would kind of fudge around it,
That's right.
and well, these claims haven't been substantiated, and but to come right out and say everybody knows this is a lie. This has already been thoroughly examined. Even all the Republicans in the Congress said basically there's no evidence to support this. This is just an out-and-out lie. And yet, that's what we seem to get from this administration, one lie after another. And they're so brazen about lying, and that and then they don't back down. Trump gets called on it. I mean, people can say there's no evidence, this has been proven to be a lie, and yet he doesn't back down. He continues to make the same kind of assertions, no matter how false they
He did that
are.
in two areas. One, he did it with torture, where the evidence clearly shows that torture doesn't work. But he says, well, the guys I talked to say it does, so
Yeah.
we should do this again. And he did it on his taxes. They showed actual tapes of him saying, I'll release my taxes. I will release these at some point in time. And now he's saying that's not going to happen.
And I think
Sure.
also the media is dancing
Yeah.
around the word lie and the kind of bickering that they're doing amongst themselves about whether to use that word or not, whether the intent was to tell something that wasn't true. I think the media needs to be held to a higher standard than that. And I think we rely on them to be critical, to think about what they're hearing, and to tell us actual facts. So I've been interested and sort of curious at the dance they seem to be engaged in about avoiding the word lie and what to do about it.
Yeah.
It's
And
been,
they use that word intent, which is the dictionary definition if you're lying, but the other part of that definition is, but if you do the same thing over and over again, then we can pretty much conclude what your intent is.
Sure.
Your intent is to deceive people.
Yeah.
right.
Right.
And it's really going to be critical for the media to step up and play this role, despite all the assaults from the administration telling them to shut up, as Bannon did the other day, which
Right.
is astounding that somebody in the administration tells the media to shut up, right?
Yep.
Given the First Amendment of the Constitution. But especially because it appears that the Trump administration is going to try as best as it can to censor and muzzle federal agencies
Yeah.
from telling us the truth. To tell the EPA, for example, that they can't report on the findings of concerning climate change or environmental issues
Unbelievable.
without having them first vetted by political operatives. Well, again, this is censorship, and it's attempting to prevent information about climate change and environmental issues from getting to the American public. It's as if somehow if the EPA is muzzled and can't talk about it, people won't find out about these things. And so again, that's where the media plays a role. And it's interesting that so many scientists are really pushing back, because
That's right.
this appears to be a very anti-science administration, and they don't believe in science. They construct their own alternative interpretations of the world, which are completely false, and have no data to back them up, no evidence to support them. But they then denigrate the scientists who are working hard to present an objective point of view concerning what's happening
But then
to
they
our
also
environment.
denigrate where those scientists would publish, which is the media. So if they demonize those two things until their followers, this is appropriate.
Right.
Because that's the audience that
Good
they're talking
point.
to.
Yeah.
Yeah.
I heard this morning that the scientists, they're organizing a march from Washington,
Yes.
which I think would be great. And it would really call attention to their refusal to face facts. You can't alter the facts. I mean, the facts are there. I think that's really, yeah, I mean, there's no wonder that 1984 has become such a bestseller,
Right.
because that whole idea that lies are truth and everything that's in there is who are you going to believe, your eyes or me, or, you know.
Using the power of the state to control the message, and he's definitely done that.
Yeah.
At least that's the way he's starting out. I don't see him backing down from that at
No.
all.
Right.
Backing down doesn't seem to be in his vocabulary.
How
so-
astounding is it that scientists who devote their life to the objective study of the world feel compelled to march on Washington?
Unbelievable.
I mean, you would never think scientists, even under any previous conservative administration, Republican administration, scientists would have never felt compelled if they had to march on Washington just to assert that the scientific truth should be honored. That's really astounding. But again, it fits in with the fact that there has been so much pushback, so much resistance, so much protest
Yeah.
that's been occurring. And I just wanted to highlight a couple of things that happened locally. Alan Webb and some of our other colleagues up at the university organized an outstanding teach-in
Terrific.
to focus on the various threats to the climate and to various other vulnerable constituencies. And it was an all-day teach-in on Martin Luther King holiday from 10 to 3 in the Bernhardt Center. It was an ice storm that morning. As I arrived, I was thinking, oh, we're not going to get very many people here because of the
So
storm and the road conditions. And yet the room was already overwhelmed.
Yeah.
It was standing room only.
Fantastic.
During the course of the day, we ended up having over 550 people registering, and there were obviously some people that didn't formally register for the teach-in. So it was an outstanding success of variety of excellent speakers throughout the day, covering almost every imaginable topic: immigration, climate change, the media. I mean, we covered the waterfront.
Great.
So it was really an outstanding thing. And then our good friends at Peace House organized a candlelight vigil on the day of the evening of the inauguration. And again, over 500 people showed up in Bronson Park on that evening to express their concern about the tone and direction of the new administration and their hope for a more positive and progressive way to deal with America's problems. And then, of course, last Saturday, the Women's March on Washington, outstanding success.
Right.
I don't remember hearing the final estimates, but it was well over 500,000
Oh,
to
yeah.
a million
Yes.
Close to a
women
million,
that
I
marched
think.
just in Washington,
That's
D.C.
right.
A couple of my students from Valley were there, so they drove up for that. So
And there were marches all over the world. I mean, it was a
Right.
worldwide event. And
Terrific.
there were sister marches throughout the country.
and
that drew
over
huge crowds.
500,000 in New York City as well, maybe
Right.
even more than that. So
Yeah, and in Kalamazoo, there was a sister march that was organized sort of at the last minute. Some women felt compelled to do. They couldn't go to Washington, and they felt, well, we need to do something. And so at the last minute, they organized a march. Over 1,000 people turned up on
That's really
Saturday to
terrific.
march from campus to downtown. Kalamazoo Nonviolent Opponents of War held a vigil in support and solidarity with the women that were marching in Washington, and we had a good turnout for that.
Very
So
Right.
it's the one thing that is striking to me given the Trump administration is the way in which there is this resistance that is mounting. And we're seeing people who have not been active before, who are
Yes.
saying, you know,
Yes.
this is such a threat.
That's right.
What this administration is talking about, these actions that they're proposing to take are such a threat that we need to get off the couch. We need to get out there in March. We need to mount some resistance. And I'm hopeful that this initial resistance will continue to build and grow as we move forward.
Yeah.
Right, I participated in the march here in Kalamazoo, and I know that it was started on Tuesday. That's when they started thinking about it. And it was a small group of 5 people that were going to start at somebody's house, and it just ballooned into 700 by that Thursday. And then by the day of the actual march, they had over 1,000 people register, and they think more actually marched without having registered ahead of time. And everybody was there. It wasn't just women. It was all sorts of people from all walks of life. And the mood and the attitude was really empowered and empowering. So it was a really good experience. And if I think that can be harnessed, there's a tremendous amount that could be done. That's my
Right,
hope. That's my
right,
hope.
yeah. In 5 days, you were able
In
to put
5
that together.
days,
Wow.
right.
With
Yeah,
an eye
that's
towards,
amazing.
you know, not only direct action now, but the fact, you know, I was telling some of my friends that we're 2 years away from the next set of congressional elections.
Yeah.
And
Yeah.
we really want
Right.
to take some next steps that are going to have some serious impact. This is when people have to come out in large numbers, you know, to come to be at the ballot box.
Right.
That's really what has to happen. This all has to translate into political involvement.
Right.
Because that's where the decisions are being made. And we have to mobilize to make sure that we get our people in there. And it's so difficult in a situation like this where the Republicans have gerrymandered it to make it almost impossible to beat
Right.
this guy. But we have to push him, and we have to think about who is going to be our standard bearer and start backing that person immediately, I think. Start
Agreed.
working on that.
Yeah, yeah. Well, the one threat that's certainly looming with the new administration is they've targeted the Affordable Care Act. And now, of course, the Republicans have hated the Affordable Care Act from the very beginning because Obama proposed it, and Obama was able to push it through a Democratic Congress early in his administration. It's interesting that the features that make up the Affordable Care Act actually came out of a conservative think tank,
Yeah.
the Heritage Foundation.
Right.
This was essentially a Republican plan,
Right.
a Republican plan to try to deal with health care for a long time.
And it was implemented in Massachusetts, if I'm not mistaken.
Yeah,
That's
It was
right.
Romney Care.
It's in there now,
It was
too.
Romney Care in Massachusetts at one point.
It's a great success, I think. It was
Yeah.
really successful.
Yeah, it's working.
Okay, right.
Had some success, and but again, it just goes to show that you know, as soon as Obama was elected, the Republicans united in opposition against Obama and said anything he does, we hate it. And of course now they're saying, well, everybody should support Trump, give the president a chance, and of
Yeah.
course they did not do that for Obama. So yeah, I think one response is, well, yeah, we'll give the new president all the respect and support that the Republicans did to President Obama, which wasn't much, right?
No.
But so the Affordable Care Act. Now, the health care issue is a very tricky issue, and there's sort of 2 basic problems, I think, that, you know, that we face trying to deal with health care. One is that the costs are skewed. So about 10% of the people account for over 2/3 of all the health care spending, okay? So there's a group of people that, because of various problems, are going to have to spend a lot of money, are going to have a lot of health care. And then the other problem is that what you have is asymmetric information. The people that know the most about their own situation are the people affected, and yet the insurance companies often, who are making the decisions, don't have that knowledge. And of course, the people that know about their situations are the ones that are most likely to sign up for the health care because they know that they're going to need it. So you have these 2 basic problems. And of course, we know, and I think what we want to come back to today is to talk about the fact that if we had a single payer system, a Medicare for all system, we could take care of a lot of these problems very easily. But that was off the table. I mean, that was not even under consideration. Even a public option to be included within the Affordable Care Act was eventually dropped. So, so one of the problems is that we keep the private insurance companies in play, and you have to build some kind of program around them. So the Affordable Care Act basically mandated that everyone get insurance because if the people that are healthy and don't think that they need health care don't sign up, and only those people who do need it sign up, then it's going to really affect the cost and the coverage. And so the mandate was that everyone should be participating, and if people couldn't afford to purchase in some of the exchanges that were created, then they were going to be subsidized.
Yep.
And the subsidy came with a tax on wealthier people. And so, we had the outlines of a program here. The Affordable Care Act also, we should most importantly mention, had a couple of other features that were really necessary and important. One was the ban on being excluded because
Right.
of pre-existing conditions, right?
Yeah.
So the insurance companies, this was a device that they used to avoid paying people who needed insurance the most.
That's right.
Right? And so if you had a pre-existing condition, they would simply say, no, you don't qualify, or else your premiums are going to be extremely high. They try to exclude those people. The Affordable Care Act says you can't do that anymore. And it'll be very interesting, whatever replacement, air quotes there, replacement that the Republicans come up with, that's going to have to be an essential feature, or it will be rejected, I think, by a large number of people. There also was, I think, for young people, the idea that they could stay on their parents' program until the age of 26. Prevention services were
Right.
encouraged, and of course, that's critical. I mean, if we spent more money on prevention services, we could reduce healthcare costs enormously. But often, prevention services were not included in a lot of the plans.
And part of that prevention would be if everybody has health insurance, they would begin to engage and have relationships with doctors at a much earlier age
Yeah.
to catch things, as opposed to getting insurance like has to happen for some folks. Well, they don't get insurance for the first time until in their 40s or 50s.
Right,
And they got diabetes or something like that.
Yeah.
Right.
And it's much more costly.
right, right.
So these are the features of the act. Now we can get into some of the problems with the act and some of the other issues, but the Republicans have been attempting. What did they vote? Something like 57 times.
Yes.
Yeah.
close to
Congress to
60.
repeal it
Yeah.
during the Obama years, and of course they couldn't do that. Now, of course, with the Trump administration, they do have an opportunity if they can get it through the House and the Senate, which they have majorities in, and Trump will sign it. They can finally repeal the ACA. They can finally get rid of the hated Obamacare. Now, what are they going to replace it with? We don't know. But let's just focus for a moment, and Angela, this is where I want you to talk a little bit, because
Sure.
the repeal of the ACA, the Republicans say, well, this problem and that problem, let's get rid of it, it's not working, but it's going to be devastating for a lot of people,
Yes.
isn't it?
It-
And your own family situation would be impacted by the repeal.
It would, and I think we've heard many times now the Republicans call the act a disaster, a catastrophe, and it's hard for me to understand those words when 20 million people now have insurance that didn't have insurance before the ACA.
Yes.
So those words are hyperbole and they don't accurately describe the situation. I know firsthand experience from some of my friends and family, the ACA doesn't work equally for all. So there are still issues with it that I think could stand some attention, be fixed, and make it work really for everybody. And in my personal situation, in order to have decent and affordable health care after I left my job that had very good benefits, including health care, the ACA was the only way to get them. And for the last couple of years, that's how I and my two children have had health insurance. And it has been a tremendous boon to, peace of mind, actual coverage for things. Preventative care is covered. It's been the way that I was able to leave my job.
Let me come back I wanted to come back to that point, but you made something you said earlier that most people don't understand. 151 million Americans, I believe, have insurance on and above the Affordable Care Act because they have it through their employers.
Right.
People make the assumption or they have the understanding that everybody's insurance is under the Affordable Care Act, and that's not true.
That's right.
That's
So
very
let's
right.
let you
Good
go ahead and
point.
finish what you
That's
were saying.
right. And so I
Just
did
to clarify that,
Right, and I was one of those 150
Yeah.
million people before I left my
Yeah.
job. I had a very good job with very good benefits, including health care that covered my entire family. My son was diagnosed with autism when he was 4, which was about 3 years ago now. And so, we had health insurance, I had a full-time job, but what we realized very soon, before the diagnosis and of course after, was the attention that he needed from somebody at home with him. He wasn't in school yet. I had 2 weeks off from work at one point, and I just noticed during those 2 weeks that he spent with me, the number of things that he was able to do on his own, just working toward small tasks, gaining independence in some areas. And I realized leaving my job was going to be the best thing for him and the rest of my family. Because I knew about the ACA, because I'd kept my eye on it, I knew that we could sign up, we'd have health insurance. And what good does my health insurance do me through my employer if I work full-time? I can't take my son to therapy appointments. I can't take him to the things that he needs. Even if it's covered, it's very difficult if you're working an 8-to-5 job, Monday through Friday.
Right.
So when I quit, I had the freedom, I had the flexibility. We still had decent and affordable health care. And I do want to say, being covered, in my situation, it probably can't be considered a life or death issue. And I think it is for some people. If some people lose the coverage that they have, it could really have very serious effects on their life. And for us, it would also have those effects to maybe a lesser degree. But I can say that knowing that my presence at home all the time with my son was what he needed, and now seeing a few years later the progress that he's made, and the advances that he's been able to do, and the obstacles that he's overcome, and the fact that he's in a general education first grade classroom now, I don't think that would have been possible if I had to continue working. So the ACA really, I'm so grateful to that act and to President Obama for making that happen, because it really has improved the quality of my life and my entire family's life.
Wow. And we've got, if I'm not mistaken, we had the lowest uninsured rate that we've had
Ever.
since we've been tracking healthcare statistics in
That's
this
right,
country.
that's right.
And we still have about 30 million people that are uninsured,
Right.
despite the ACA and all of that. So
That's right.
you were able to tell your story a couple of weeks ago. There was a vigil in front of the federal building. Kalamazoo Nonviolent Opponents of War teamed up with the Bernie Sanders Our Revolution people, and the focus of the vigil was to talk about the Affordable Care Act, and you came that day and presented your story. And there was another young woman that got up and talked about it, and for her it was a life and death situation. Given her medical condition, she said if she lost her health care under the ACA, she really didn't know what was going to happen. It really was for her more of a life and death situation. And I just want to call everybody's attention to a report that was the news article in the Washington Post this week. So it was David Himmelstein and Steffi Woolhander, and we know these two people because they have been writing and talking. They're both doctors. They both teach at Harvard Medical School as well as Hunter College in New York. And they've been writing about single payer, Medicare for all, for a really long time.
30 years.
They really know their stuff. And they pointed out that if the ACA is repealed, that the best estimate would be that about 43,000 people would die annually. 43,000 people die annually. Now, Bernie Sanders said something about 36,000, and he was criticized. But Himmelstein and Woolhander went back and said, no, actually, Bernie was right on target. He was looking at the appropriate studies, interpreting the data correctly, and in fact, it's even a little bit worse than what Bernie said. And I noticed Bernie the other day changed and said 43,000,
did he?
which is in the 43,000 figure. But this was published in the Washington Post by these two doctors who have been studying the issue for 30 years or more. And I just think we really need to consider that. 43,000 people might die because the Republican Party hated Obama and wants to get rid of something that Obama did, which was originally their own idea.
Yes,
boy.
right.
Wow.
Think of the irony in that.
Now, of course, they say they're going to replace it with something better.
But they've had the last 5 years to do that.
Right.
That's right.
And yet here we are today. What are we hearing? Well, we're not sure how fast we want to proceed with this because we really don't have a, quote, replacement in place. Well, why not?
Right.
You are passionate about replacing it, about repealing it, and you don't have anything to put in this place because they've realized with their phones ringing off the hook, pre-existing conditions, that people want to keep their kids on their insurance.
Yeah.
And that's what they've been hearing. So now all of a sudden they put the brakes on.
Yeah.
But
Well-
the question is if enough of them are willing to do that.
Well, and their claims, too, that they want to keep what people like about it
Oh.
and do away with the parts that people don't like, it won't work.
You can't do that.
Those pieces are
Mathematically,
dependent
it
on
doesn't
each
work.
other.
Yeah.
And like Ron said earlier, if the pool of people in the system are all sick, that's what raises the premiums to unaffordable levels for a lot of people. So it does seem like the plan is to unravel everything that the Obama administration did and stood for, and this has been a huge source of pain for the Republicans for several years now.
And it's more symbolic than anything else
Right.
initially, right?
Yeah.
It's symbolic. This was Obama's signature achievement as president. Therefore, we have to attack it.
Yeah.
I mean, so it's just political spite.
Yeah.
It's like a temper tantrum by a political party over something that the other administration did. And are they really thinking through the hardcore issues related to this? Obviously, they haven't been able to do so. They haven't come up with any kind of replacement plan that makes any sense, that retains the features of the ACA, that provides adequate coverage for the millions of people who are at risk here. And I mean, it just, to me,
Because
it's...
if they had, they would have something ready to go right now.
Right.
But
Yeah.
they don't have anything ready to go right now.
Right. I found it interesting that earlier this week, I think it was that Donald Trump stated that everybody would have health insurance.
Yeah, he did. He said that.
And I don't know if there's anything behind that, because he said other things that turned out to not have much weight behind them. But I'm glad he said it in a public way. Republicans know he said it. So it'll be interesting to see what they do about that.
He said everybody would keep that has it, nobody would lose their health insurance. We would put a plan that would make it better.
Yes.
And it would be cheaper.
Yes, cheaper and better were the words,
We
I
know
think.
how to do that. It's
And
called
without the
single payer.
mandate, without the mandate, I don't see that happening.
No.
Because
Yeah.
again, as you said before, the pool will be limited to people who are the sickest.
That's right.
And part of the problem right now with the ACA is that a lot of employers didn't drop their health care
No.
coverage, which was expected that they would do, and allow those people to pick up on the ACA. But some employers, or not as many employers as projected, did that. And so you have really too few healthy people signing up for the ACA in some of the markets.
Right.
Now, the other problem is that we really have sort of 51 different markets here, the
That's right.
way the ACA is
Yeah.
designed. And so there's a couple of states where it's not working as well, but in most states it's working very well. Michigan is one of the states where it's worked extremely well.
Right.
And so again, you have too few healthy people signing up for the plan in some places, despite the mandate and despite the financial penalty that can be incurred. And often in other places you have too little competition because some insurers have dropped out.
Yeah.
And again, there's no public option. So
That's right.
if
Public
private
option.
insurance companies don't become involved and drop out, that's a problem as well. And to me, this goes to a central problem with the ACA. I mean, the ACA is fantastic, and it's helped a lot of people get insurance. It's certainly improved your life. But to me, the biggest problem still with the ACA is the lack of a public option and the continued involvement of private insurance
Right,
companies.
right.
And
Yeah.
I just want to point out, the private insurance companies add absolutely nothing
Nothing.
to this.
No.
No.
They are parasites.
Yes.
They're blood-sucking leeches.
They are.
I mean,
They
that's
are.
strong language, but that's what I really think. What do they add? What do they bring to the table? Absolutely nothing. They don't help, they're not really helping people get the care that they need. They bring nothing to the table except to draw out enormous amounts of money in profits for themselves that could be going to provide greater
right.
health care for
Which is
people.
one, you talk about capitalism, which you taught me in school. Their first motive as a corporation, private corporation, is to make money.
Exactly.
The interest of your customers, that's secondary to your shareholders.
Right.
And that's how they operate.
And the best way they can make a lot of profit off of health care is to sell it to healthy people who
Yeah,
never need
that's
it.
right. That's all
Exactly.
they
And of
want
course,
to
the
do.
Exactly.
people that do need it, you don't want to deal with them, and so that's where the pre-existing conditions come in, and that's where you raise the premiums on
Right.
the high-risk pool, and all to make greater profits.
Sure.
Now, again, the reason that I say that they don't add anything to the table is because most of the countries in the world have recognized that you don't need to operate through private insurance companies to provide
right.
health care, and you could do it much more simply at far less cost, simply by having people pay taxes into a government fund like we do with Medicare.
Exactly.
Medicare
Sure.
for all. People pay taxes into a fund, and then health care is free for people, that everyone is covered, everyone can go get the care they
Yeah.
need. The government then can set the appropriate compensation for the providers, who then simply have to bill one source. It eliminates enormous paperwork. You can reduce the administrative cost by 20%
Yeah.
at the least, and everyone gets covered, and everybody else in the world does this.
Right.
We're the-
And they do it in a fairly efficient way.
They do.
And their care systems are not falling apart, which is what the prediction was going to be here.
Right.
Yeah,
Right.
It just
yeah.
doesn't work out that way.
Yeah.
That's right. That's right.
Yeah.
And nobody would have to go bankrupt because
No.
they had a
No.
diagnosis of a medical condition. I think we're the only nation of our sort that has that as a,
Yeah.
as a real possibility.
Yeah, I mean, the 15 to 20% of the healthcare cost is spent in administrative kind of things. whereas in Canada, it's less than 5%. So think about that. Our health care bill is between a sixth and a seventh of our cost, of all the money that we spend in a year, between a sixth and a seventh goes to health care. Now, we got a $17 trillion annual budget. So we're talking about $2.4 trillion that we're spending on health care a year. Think about 20% of that, we're getting no health care at all for. And the sad thing is that there are so many other models out there, like you're saying. I mean, we know that other countries have done this, have found a way to do it. The cost of health care, what Canada spends on its health care is about half per capita as what we spend, and they're healthier.
And that's what I'm saying. Think about all those other countries. For all the money that we spend on healthcare, and we spend a ton of it, our outcomes nowhere near as good as the other countries who do it in a more efficient way.
The World Health Organization rates us as 32nd in the world in the provision of health care for our people.
So we pay twice as much than most other comparable countries, and we get much, much poorer results with our model.
And we do such damage to our people.
Yeah.
It's an international scandal. It's an international scandal that the richest country in the world has such poor health care results and spends so much money. But again, so much of that money is drained away by pharmaceutical companies, by insurers.
Pharmaceutical, that's another thing. Yeah.
Well, and again, we don't allow, there's a ban on negotiating drug prices.
Right, exactly.
You know, that's just crazy, which allows the pharmaceutical companies to artificially keep the prices high and rips more money out of the system.
And we saw that this summer with the whole scandal over the EpiPen.
Yeah.
The price of that just skyrocketed up to, like, you know, from some reasonable cost to up to several $100s, you know. It's like, why?
Yeah, no reason.
No reason whatsoever.
Except they could make more money.
Make more money.
That was the whole thing, and there was no way to stop that legally.
And the fact that you can't call a hospital and say, what is the cost of this procedure? And they can't just tell you the cost. There's no menu that shows if I have this done, it will cost me this much, because it depends if I have insurance, which company I have insurance with. That determines the price. So it's so intertwined in a way that leads the consumer to not really understand where the money's going, how the money's being spent. And I think I'm all for single payer. That's the way I think it needs to go.
And there still could be supplemental insurance, right?
Yeah.
I mean, there's certainly going to be some medical procedures that are going to be difficult to cover under a Medicare for all procedure, or will cost more.
Or you have to wait longer.
Or you may have to wait longer. And it may be that people need supplemental insurance to cover certain things, and you do that already with Medicare.
Sure.
You can buy a supplemental plan to protect you even more and provide even more. But the fundamental care, health care for most people, including the preventive services and addiction services and you know, just so many ways in which the American people could be better served and become healthier, would be greatly enhanced with this kind of a system.
Yeah, I mean, it's important to realize that the Affordable Care Act was a compromise. It wasn't really what we wanted. I mean, we really want health care for all, we want Medicare for all. Yeah. But politically, this seemed like the only thing they could get through. And Obama himself said, you know, if I was starting from scratch, I'd go for single payer. But it's the political thing. We know what a healthcare system that would work for everybody looks at.
Right.
It covers everybody. It's comprehensive. It's affordable to the country, and it's accessible, and it emphasizes prevention. And that's what all the other countries in the world, the developed countries in the world, base their healthcare system on. But our healthcare system is based on profits. And who's going to make money out of this? And how can we preserve keeping their profits through this whole thing? And it's disgraceful.
It's privatized, and it's also considerably unregulated.
Definitely.
And so, given those two things, if you have a private market system providing the commodity here, and it's an unregulated market, then you're asking for big trouble.
So our healthcare system is really shaped not by what is good for our people, but by the lobbying that goes on by the people that are making so much money, the insurance companies, the pharmaceutical companies, some of the hospitals. These different people have huge lobbying groups in Washington, and they get to shape the rules that come out for how people in this country get health care. And
What
it's
did they say
disgraceful.
during the Watergate investigation? If you really want to know how something works, follow
the money.
Follow the
Right.
money.
Yeah.
Then you'll find out who's actually profiting from this.
Right. And if we start thinking again about pre-existing conditions and the fact that health insurance companies may be able to bar people again because of a pre-existing condition, that has to be terrifying for countless people. My son has a pre-existing condition. He's
Right.
7 years old, so if this means he's
God.
unable to get health insurance, he's still pretty young. Those of us who don't have a pre-existing condition are feeling pretty lucky and pretty hopeful that we don't get one before we know what's going to happen with the ACA, because if
Yeah.
it disappears and pre-existing conditions can then be a reason to not get any health insurance, I don't know what many of us will do. And it's terrifying.
You've had to make some very, very difficult decisions and pay very high prices.
Yeah.
And that shouldn't have to happen to
No,
you.
no, I agree with you, and I'm glad for the ones that we made. I'm glad they were possibilities for us, but you're right, it doesn't have to be that way.
No, it
Right.
doesn't have to be that way.
Right.
Because the stuff they're talking about in terms of replacement, they're talking about
Scary.
the health savings accounts, and I know what those, what that worked back in the day, the health savings accounts and high deductibles.
Yes,
So that before you can even access your insurance, you got to pay a whole lot of money out of your pocket.
right,
Yeah.
that's
And
right.
the subsidies, the health savings accounts never cover enough, give you enough money to actually go out there and get your own insurance.
And
How-
states will have all kinds of economic incentives to skimp on that
Yep.
or cut those
Yeah.
as they go
Right.
forward.
Yeah.
But again, what that does is it keeps the private market
Yep.
in play, right? And allows the insurance companies and the hospitals and the pharmaceutical industries to continue to make big profits off of this.
That's right.
So, and it's interesting, the polls have shown real changes in the American people. I mean, single payer now is favored by a majority of the American people, which wasn't the case before. I don't think people understood it before. But now it's a majority of the American people, and it's growing, the number of people that favor single payer, Medicare for all. So, I think the issue is really mobilizing around that and forcing these people to do the right thing. We've got to do that.
And I read recently that one of the groups that will be affected are veterans. A lot of them don't go to the VA, maybe
Right.
because they have a policy
Yeah.
through the ACA, and if that ceases to exist, the already overburdened system that the VA is will have more
Wow.
to deal with. So it's not just me, there's so many
Yeah.
people
Yeah.
in far worse conditions than I am or my family is, that they don't deserve this.
No, they don't deserve it. No.
Because, the first argument that Republicans gave was that, well, we'll put this out, no one will sign up. Now that people have signed up in large numbers, they want us to believe that, well, that's not the case. We're not supposed to believe that, Those are alternative facts.
That's right.
Alternative facts.
Yeah, the number of uninsured has dropped. The costs haven't. The costs are far less than what were projected, and the overall medical costs have risen at a much slower rate than what was projected. So to a large extent, yes, the ACA has been successful. It's done a lot of the things that the Obama administration wanted it to do.
Yeah.
It's not perfect. It's not the system we would have constructed had we started from scratch, like you said, Don. But there's no doubt that this has been a somewhat successful program, or a very successful program in a lot of ways. And now for the Republicans to come along and say they want to completely repeal it without having a strong replacement in mind is just unconscionable.
Under the guise of telling people that we're going to give you more freedom. And I always say, that means that's a subterfuge for freedom to pay more money out of your own pocket. That's what it's going to come down to.
That's right.
Freedom to get sick and die without
Yeah,
having
right,
any access
right,
to
Right.
care.
Oh, boy.
Yeah.
Yeah, I think this raises fundamental questions. All the things we've been talking today raise fundamental questions about what kind of a country do we want to be. What they're pushing is a very individualistic country. And what really we've talked about before, what we've said, we've held at the ideals, is that we're in this together and that we have to care for each other. But they're pushing us in the exact opposite direction. And so, there's choices that have to be made here by the American people. Do we want to go that route, or do we want to take the stand that we're all in this together?
Right.
That's where we're going.
We are stronger together.
That's
So-
right.
Right,
That's right.
right.
Yeah.
So what's going to happen next? What do you think the Republicans are going to do?
Oh, well,
They're going to repeal it.
Yeah, that's going to happen.
Right.
No doubt about that at all.
But they might delay and say, this is going to be repealed in this,
You're talking about putting a sunset provision in like 2 years out.
right, after the next election, yeah.
'Cause I think they spent a lot of time in rooms together this week, and there doesn't seem to be any consensus on what the quote replacement is going
Yeah,
to be.
That's right.
Okay.
You know.
So can they repeal it without any, at least a subterfuge of replacement?
If they
Fig
keep
leaf.
it
They
in
have to have at
place.
least a fig leaf of replacement,
Yeah.
right?
Right.
I think they do.
So
If they keep it in place, but Senator Collins from Maine and another Republican senator came out with a proposal this week that I don't see how it could work. But what they're saying is, if states want to keep the existing system, then they could keep the existing system, and those that want to move can move.
Yeah.
Oh, but what? To what? They didn't
Right.
say to
Yeah.
what. They
Yeah.
don't know to
Right,
what.
right.
Yeah.
So that means you're not repealing it.
Right. And will it matter that Trump said there will be insurance for all? Will that ever come back to haunt any of them?
Yeah.
That he made this promise to everybody?
I mean, basically Trump said there's going to be insurance for all, and it'll be better, and it'll be a
Yeah,
lower cost.
Right. Yep.
Now, how can he do that? There's only one way he could fulfill those three things.
Exactly.
They
One
will
way, and
kick
that
in.
would be
Single
Medicare
payer.
single
for
payer,
all.
Medicare
Single
for all.
payer.
Now, we know he's not going to do that,
No.
right? But I think, yes, his impulsive, statements there,
Yes.
and they were impulsive,
Yeah,
and I'm
they
sure
were.
I'm sure some of the Republicans cringed when they heard
I'm
him say that.
sure.
Right? But that's the thing. We have to hold them. We have to say, look, President Trump said that this is going to,
Yeah.
everybody's going to be insured. So how's everybody insured
Yes.
under your replacement plan? They're not. Therefore, it's a flawed plan,
That's
right?
right.
And when asking Tom Price those questions during his confirmation, he wouldn't answer the questions either.
No.
He wouldn't answer that
Or
question.
he used weasel words like, well, everybody's going to have access.
Yeah. What does access mean?
Yeah.
He said you can
Yeah.
pay
If you
for
can pay.
health insurance.
Yeah.
We'll give everybody the right to pay for health insurance.
Yeah.
And Bernie Sanders said he had access to a $10 million home, but he didn't have the $10 million. So it was not going to happen. I think it was him that said
Good
that.
Yeah,
parallel.
it was Bernie that said that, yeah.
So they are definitely choosing their words very carefully. The ones that are the policy wonks, people like Paul Ryan, access. I'm like, what does that mean?
Yeah.
And I think that this is an issue where they could stumble because there's so many people involved that are going to be hurt if they don't do this right. They're not talking anyway
And a
about
lot of
doing
a
it
lot
right.
of people happen to be Trump supporters and
That's
voters.
right.
You know?
A lot of these people that were Trump supporters, if they start losing their health insurance, they're going to say, whoa. And a lot of them that were his supporters are getting assistance now
Yeah.
through the health care. So,
Even if they don't know it, and which seems to be the case with a lot
Exactly.
of folks
They
who,
don't
states,
even
who live in
realize.
states that had Medicaid expansion, they don't realize that came about because of the Affordable Care Act.
Yeah,
They don't put those two things together.
No.
Yeah, the demand is to repeal Obamacare, but don't touch my ACA. Right?
It's a shame they came up with the word Obamacare
Yeah.
because I think
Yeah.
that alone,
Well, it was a
That was done on
racist,
purpose, though.
politically
Yeah,
inspired,
right.
and the Republicans are pretty good at putting those kind of framing and
Yeah.
using those kind of symbolic language to denigrate what the administration was trying to do.
it was effective.
Yeah,
It was
it
effective,
was effective.
politically effective.
They
and,
sold that narrative, and a lot of people in the public bought it, unfortunately.
That's right.
yeah, the branding that the Trump administration has been doing that. Now the American people are in charge. Well, the polls show what the American people want, but that's not
Yeah.
in their mind at all. And when they say the American people, which American people are they talking about?
Right.
It's not like we're one American people.
That's right.
We're very different.
As we've already seen with this administration and their cabinet appointments, when they're really referring to corporate America.
Exactly.
Yeah,
And
exactly.
protecting corporate profits is the underlying goal here, it would appear. So this talk about protecting the American people is all a smokescreen.
And then he talked about, bringing all these coal jobs back. But there was a couple pieces in the Times and other papers that I've read that says the vast majority of coal jobs have left because of automation.
Yeah.
That trend is
Right.
not going to turn around,
Exactly.
And
the
lower,
other,
lower market prices
yeah,
for
for-
natural gas.
Yep.
Yeah.
So the fracking boom has really been what has undercut coal as
Yep.
well.
Yeah.
So yeah, there's no way. It's not that government regulations have been the thing that
Yep.
has caused the coal industry to decline. There are other factors, economic and technological factors.
And the same is true in other segments of manufacturing.
Exactly.
We see the same thing,
Technology.
automation,
That's right.
Yeah. Yeah, I mean, the reality is we don't need as many workers as we
Yep.
needed them before. And that's going to continue
Oh, yeah.
That trend is going to continue.
definitely.
So we really face a policy challenge in the world, actually. What are we going to do when we don't need so many workers?
I mean, think about this. If you look now, and I was telling my daughter, I said, I'm telling you now, in 10 years, there will not be human beings driving trucks. I mean, we think this is a novelty thing with all this automation going on and self-driving. I said, but in tangible terms, Uber, truck driving, that's all going to be done autonomously now.
Right.
I said, mark my words about this. So those are people who have jobs who aren't going to have jobs 10 years from now.
How many people are involved in that?
And like you said, Don, there are going to be a lot of people that are going to lose their jobs behind this, our technological advances.
Right, but you can't vote against technology. So if somebody
No.
else is made to look like the bad guy,
Yeah.
that's
Yeah.
who you want to blame if you're experiencing
Exactly.
hardship. So you can't,
Yeah.
get mad at automation and vote against that. So it was, again, an effective ploy.
Well, this is what drove the Trump phenomena. It's this sort of right-wing populism where you rile everybody up who is certainly suffering economically,
Right.
but then rather than point them to the true direction of their problems and their concerns, you deflect their
That's right.
attention.
Yeah,
Well, it's all
that's
his
right.
fault over
Yeah.
there.
Yeah,
It's
yeah.
the minorities. It's
And what do
the
we know about
Mexicans.
fear? Fear has a tendency to trump judgment.
Yeah,
No
absolutely.
pun intended, but it does. When people are fearful, they don't use really good judgment.
That's
No,
right.
no.
Yeah.
You cling to the thing that
That's right.
sounds good. at
And then
the
they rack
moment.
with that reptile brain, and it's impulsive.
Yeah. And we're getting back again to the denial of science and facts. The reality is technology and globalization are here to stay. That's just going to increase, and that's going to demand dramatic changes in the way our societies are structured. But they're not talking about that. They're talking about superficial things that are really going to hurt us.
And what that demands, Don, is rational planning by public agencies, by government.
Not much chance of that, is
Yeah.
there here?
Well, no, but I mean, again, if the ideology is all individualism and
Exactly.
allowing markets and corporations to be completely free to do whatever they want to do, whatever in their best interest, and there's no long-term planning, no rational planning, then you can't address these
That's
issues.
right.
I mean,
That's right.
how can climate change be addressed unless it's
Oh.
addressed through government,
Yeah.
through public agencies who are engaged in rational planning
Right.
to mitigate carbon emissions and to provide for adaptation to the climate disruption that's already
Yeah.
built into the system?
That's right.
And if ideologically we can't accept that or block that, I mean, that's where a lot of the climate denial comes from. I mean, the people that are engaged in climate denial seem to recognize at some fundamental level that the only way that climate change can be dealt with is through an expanded role for government and government planning. Well, ideologically, they can't accept
That's
that,
right.
so they
That's
don't,
right.
they don't accept the facts about global warming.
Right.
And so until it ends up on their doorstep, as my friends who have spent time in Shanghai and Beijing see, when you have walk out into an atmosphere that you barely can breathe in,
Right, exactly.
they're not going to pay any attention to it.
Yeah.
That's
Yeah.
They
right.
think that's somebody else's problem.
That's right.
Yeah.
That's right.
Well, we have about 4 minutes left in the program. I just want to alert you that we're getting near the end. What I want to ask, and this applies not only to the ACA, but I think more broadly, is what are the Republicans going to do? I don't think that all the members of the Republican Party are in lockstep with Donald Trump, and I think they see him as a very unstable person, impulsive, narcissistic, and they're fearful about some of the things that he's doing. But what will they do? I mean, they can ride Trump and get a lot of their regressive agenda passed,
Yeah.
and then would they, once they get most of their regressive agenda, cut him loose because they see him as too big an obstacle to any further progress? It seems to me that right now, unfortunately, our only hope to block the worst aspects of Trump are for some Republicans to turn against him.
Well, here's the thing. A lot of those folks are operating out of fear. So the question asks if you're a member of the House, well, when's your next election? Because they're so afraid of alienating Trump supporters in their district, they're going to go against things that I think, and I think they understand too, are against their best interest. So that's where I'm fearful. I agree with you, Ron. I think at some point in time, this administration is going to engage in overreach, and it's going to be an overreach that folks are going to say, wait a minute, that's as far as I'm going to go.
Yeah.
I can't go any further. And when that happens, the question will be, what's the nature of the overreach, and will it be too harmful for us to be able to come back from? But I just think right now there's a lot of fear in the Republican Party to go
Right.
against anything that he says.
Yeah, I think that's really accurate.
And that's a
that
huge challenge.
Could come with climate change things, as we see some of more of the destruction of that. It could come when the healthcare thing backfires, or it could come really quick with immigration. I mean, the way the mayors around the country are saying, we're not doing this. We're not going to go door to door. We're not going to come and
Right.
root out these people that are living peacefully in our community. So, yeah, I think you're right. It's going to force the hand to some of these Republicans, and that's just what we need to do here in Kalamazoo.
That's right, that's right. And I wish I knew what was going to happen next, but I think the things that have already happened this week have left me kind of more troubled than I thought I might be after one
Yeah,
week in the
me
office.
too. Me too.
Yeah. Well, one of the things I think that we have to keep doing is keep protesting, keep resisting, keep making the point, keep making the argument, and we need to put pressure on the Republicans. So, I mean, I think people in the 6th Congressional District need to keep contacting Fred Upton.
Yep.
I mean, I think Fred is not in line with the Trump agenda 100%.
I don't either.
I know he probably isn't. And I think Fred could be one of the voices of reason within the House, within the Republican Party. But he has to feel the pressure
That's
from
right.
us. He has
Yeah.
to feel the pressure. So I think everybody needs to, make it a regular thing to contact Representative Upton and tell him they disagree with the direction the country is going under Trump, and they're opposed to the building the wall, or they're opposed to the immigration plan, they're opposed to repealing the ACA without having a replacement for it. And he needs to hear from people. And so I think that's the biggest thing people could do.
And I think there's a model for that. I think the moral majority movement that's taken place in North Carolina with Reverend Barber, where every week they show up at the offices of their state legislatures and they get masses of people out there who are demanding change. We should be doing that.
We
with
should,
Upton.
we should. I'm glad to hear you say that, because that's who I called before I came down here today. I
Right.
called Representative Upton's office
Yeah.
in D.C.
Fred could be a hero here.
Yes.
He really could.
Yes.
And we would want him to be.
We-
Somebody
yes.
has to do this. I liken it to, there has to be an Edward R. Murrow moment at some
That's
point
right.
in time
Yeah.
on the Republican side.
Yeah.
That would tip the scales.
Yeah.
Somebody has to step out and do that, though.
Yeah.
All right,
Yeah.
well, we're almost at the end of our time. I just want to let people know that there are a number of groups that have organized. There's the organized West Michigan group that put on the teach-in, and they're continuing to meet, and they're going to organize some events around the healthcare issue, around the ACA.
Good.
So KNOW, and there's lots of groups that are continuing to work out there. So if you're concerned and you want to get involved, you should be able to find a group that you can work with, to participate with, and I think that's going to be absolutely necessary in the weeks and months and years to come.
Right.
So thank you for joining us on Critical Issues, Alternative Views. We hope you come back and see us again. Thank you.